All right, and switching gears now, it is Mental Health Awareness Month, a time to educate on mental health issues and to reduce stigma. Here to help is Sarah Magistro, Director of Behavioral Health at BH Care Shoreline Clinic. Sarah, thank you so much for joining us today. Important topic.
Absolutely. Yes, and unfortunately with the pandemic, we have seen a significant increase in the need for mental health services. In the fall of 2021, 30% of Connecticut residents identified having symptoms of anxiety and depression. That's such a huge number. That's our neighbors, that's our friends, our parents, our children, ourselves.
So this month is always important, but maybe even more important the past 2 years to bring awareness to this. And as you mentioned, there is a stigma. Where does this come from?
So unfortunately, there still is a stigma despite so many people with mental health issues at this time. People are afraid to talk about their symptoms, and they're afraid to get treatment for their symptoms. So we really want to get the word out there that help is available, that there are places like BH Care that are very equipped, that we want to help. We want to see you. We want you to recover and have a life that you feel is worth living.
And I would imagine with treatment, the sooner the better. So talk to us about what you offer at BH Care for those who might be struggling.
Absolutely. So BH Care really takes a whole person-centered approach. So what that means is that we offer many services to our clients. So we have the clinical services, which include therapy, groups, medication management, but we know that there's many different areas of recovery, and recovery is different for every person. So we also offer case management services that help people get resources and benefits. We offer vocational services so people can return to work, peer support, social clubs, housing services. So we really want to do everything we can to make sure that people have what they need to recover.
And I think it's important to note, I know you've said this before, that mental health and physical health go hand in hand. So we're talking about the whole person here.
Absolutely. It really is a whole person approach. It's really hard to be physically healthy if you're not mentally healthy, and vice versa. And we know that people with chronic mental health issues also face many chronic physical health issues. And by treating the mental health issues, we can also help treat the physical health issues as well.
And so how can people identify when it's time to get help, whether it be for a loved one or for themselves?
You know, I would say just reach out. If you're not sure, the best thing you can do is give a provider like BH Care a call. Talk to us about what's going on. We're very happy to hear from you. Actually, I recently had an experience where a loved one of one of our clients had given me a call and wanted to get some resources for herself. She has not been in treatment before, and we are seeing people that have never been in treatment before, and they don't know where to start. And I told her, we can help you. And she was so happy to hear that. So really, if you're not sure, just reach out. But just overall, not feeling like yourself, feeling like something is wrong, not enjoying things like you used to, is a really good sign that, you know, reach out, see what we offer for you.
So important to check in on, you know, yourself and others. So what would be your message for people who might be struggling, haven't sought treatment yet, but are, you know, thinking that they might need it?
Absolutely. Give us a call. We're here. We're available. We'll answer any questions that you have. We try to make the process as welcoming and as easy as possible for you to get enrolled and start getting the help you need. The sooner you start to meet with us, the sooner you start to feel better.
Great. And you can learn more about recovery resources at bhcare.org. Sarah Magistro from BH Care, thank you so much.
Thank you for having me.